Hey everyone, welcome to my channel. This is Christina, nurse practitioner. I'm sitting out here in my garden on this beautiful sunny day. I wanted to come out here and have a little conversation with you as well and go over an experience that I encountered with one of the student nurses that I was mentoring. So we were on the floor, we had a patient, we received assignments. The patient's Foley needed to be removed. And so we removed the Foley at 8 o'clock, and we knew at that point that she would be due to void by 2 p.m. in the afternoon, so 1400 military time. Now, when 2 p.m. came, she did not void. However, just to back it up a little bit, we were prepared and we knew what to do in the event if she didn't. So she was fresh out of surgery, about 2 days post-op, so she wasn't feeling so hot. We reviewed her ins and outs. We knew prior to removing the Foley what she had been putting out was about marginal, maybe 30 mils an hour. She was afebrile, no sepsis. We also reviewed her labs. We looked at her CBC to make sure there's no infection. We reviewed her potassium, her magnesium to make sure that there's no electrolytes that needed to be replaced. We looked at her vitals to make sure she wasn't hypotensive. And we also checked her rhythm to make sure she didn't have any ectopy. The medications that she was on, we also reviewed to see if maybe that could potentially make her feel dry. And she wasn't on any that could potentially dry her up. However, her appetite was not the best. She wasn't consuming as much as she wanted to. She was on a regular diet. So what we did was we encouraged her to drink more. We would provide her with more fluids because there was no fluid restrictions. And we would do frequent rounds with her to make sure that she was getting her needs met. We also encouraged her family to bring outside food aside from the hospital, because we all know sometimes you get a little tired eating hospital food. And so they provided her food that was based on her cultural request. We also made sure that she was comfortable. We addressed to see if she was in any pain or if she had the need to actually void. So all of these things we continued to round on and reassess. We also discussed it with the doctor to make sure that they were aware that the patient was due to void by 2 p.m. So as we know, our protocol is you do want the patient to void within 6 hours. So when the 6 hours comes and if the patient hasn't voided yet, then what do you do? So recommendation is you just get your bladder scan and you scan the bladder. Typically, if it's greater than 250 mils, this is all based off of your protocol at your hospital. But let's say ballpark, if it's anything greater than 250 mils, you typically straight cath. You would page the doctor and you would need an order to straight cath them. However, in this patient's scenario, we did bladder scan her, but she was below the threshold. And then it turned out she eventually voided. However, I wanted to be able to provide the student nurse with all the content that she needed in order to be able to address the situation properly. She reviewed all the labs. She reviewed all the output prior to removing the Foley, so she knew what the patient's threshold was. She was in active communication with the doctors. She did a great job. And then the patient, she also encouraged the patient to drink fluids and she provided them with education. All of the elements were met. The patient voided and everyone was happy. But I wanted to share this with you so then that way you feel better prepared when you're on the floor. Especially if you're able to do a bladder scan at the 6 hour mark and then provide that information to the doctor. That's huge for the doctor. And that goes a long ways. That shows that you truly care about what's going on and you're going the extra mile and you're thinking outside the box. And that's what doctors and healthcare providers and charge nurses want to see from a good quality nurse. Anyways, thank you so much for watching. Be sure to subscribe. I'm going to have a lot of upcoming videos that are going to be very educational and fun and informative. Take care.